Today we'll be anatomically and physiologically describing how a woman cheerleader in her early 20s would yell the chant "Go Tigers" at a football game in a high-pitched voice. This woman is to be considered in a healthy state with no respiratory, laryngeal, or articulation problems presented. Before we begin, let's watch an example of the woman saying "Go Tigers" so we can fully understand what we were trying to evaluate.
Go Tigers!
Since we are evaluating how a woman is saying "Go Tigers," we have to remember that the chant won't be as powerful compared to a man who is at the same age saying it because women have a smaller pulmonary volume compared to men. This means that they acquire less amount of air in their lungs, which impacts loudness. Let's begin by talking about the inspiration a cheerleader has to take to start the chant. Inspiration is very important because without it, the cheerleader would not be able to acquire the adequate subglottal pressure for yelling a chant. For this loud utterance, the subglottal pressure needs to be above 8 to 10 centimeters pressure. So this means the cheerleader needs to inhale 60 to 80% of her total lung capacity to achieve the subglottal pressure. Subglottal pressure is very important for inspiration, but is not the only thing that is active. Many inspiratory muscles are contracted and moved during the act of inspiration. These muscles expand the rib cage, which results in airflow into the lungs, which help expand the thoracic cavity to draw air into the lungs. The major ones include the diaphragm, external intercostals, the sternocleidomastoid, and scalenes. The diaphragm is the primary inspiratory muscle that contracts, giving your lungs more volume to intake air. The external intercostal muscles elevate the rib cage up and out. The sternocleidomastoid elevates the sternum, and the scalenes elevate the top two ribs. As she breathed in and reached her high subglottal pressure needed for her loud utterance, her inspiratory braking recoil was needed to overcome the need to expire so she could keep her desired subglottal pressure. You need less time in the braking action before relaxation so you can maintain the high subglottal pressure for her high voice. This braking action is different between conversational loud utterances because you have active and passive forces that are trying to cause expiration to begin. Once she got to the desired alveolar pressure, her expiratory muscles kicked in to keep the alveolar pressure higher than 8 to 10 centimeters H2O as she got louder. The major ones include the internal intercostals that pull the ribs downward and inward, the abdominal muscles that increase abdominal pressure and draw the ribs down. She needs to get louder so the use of inspiratory muscles decrease and the use of her expiratory muscles increase because of the high alveolar subglottal pressures that were required for louder sound. Her body type would be described as an ectomorph, which means that she has a high relative linearity. Her body type allows her to maintain ideal diaphragm position for speech so she is not running out of breath as quickly as an endomorph body type would. Not only does the respiratory system impact her loudness and pitch, the larynx also plays a vital part in the cheerleader's unique communication. The phonatory system filters the sound that we produce. As a cheerleader cheers "Go Tigers," the larynx is serving as a sound source for voice production as pressure from the respiratory system, as talked about previously, is transferred from the subglottal space to the glottal space and into the supraglottal cavity. As an adult female in her early 20s, her vocal fold length is approximately 11 to 15 millimeters, which differs in length in comparison to men, where theirs is 17 to 21 millimeters. Once she breathed in and reached her adequate subglottal pressure, her vocal folds are adducted, not all the way, by the contraction of her interarytenoids and then her lateral cricoid-thyroid arytenoid muscles, which rocks the cricoid cartilage forward, resulting in the downward and inward motion of the folds to maintain high pressure. The final part in evaluating how she says "Go Tigers" is by talking about how she physically uses the muscles in her mouth, soft palate, and larynx to say "Go Tigers." It is important to add that the way that we say an utterance is different from the way we write it. First, let's talk about the utterance "go." When she says "go," her mandible starts to separate and moves down to the contraction of her anterior digastric, mylohyoid, and geniohyoid muscles. The lowering of the jaw contributes to the increased oral cavity space to allow adequate airflow directed out of the mouth. The movement of her lips for "go" is a bit more complicated. When she says "go," her lips are already rounded and protruded by the contraction of her orbicularis oris to start voicing the vowel O. As you can see, her lip movement for the G is influenced by the lip movement of the O, which makes "go" a forward articulatory because the O is influenced the G. The consonant G is considered to be a voice stop plosive velar placement consonant, which means her vocal folds will be adducted for the whole time while she says "go" due to the contraction of her interarytenoids and her lateral cricoid-thyroid arytenoid muscles. The O is considered to be a back placement mid-level contraction vowel. Since "go" is a forward co-articulation, the root of her tongue will move backwards, and the contraction of the palatal levitator and the uvulus keeps the velum up and back because the velum always has to be up and back when a vowel/non-nasal consonant is produced, so no air will escape through the nasal cavity. Tigers is a bit more complicated, so let's break it up. When she says "tie," the T is considered to be an unvoiced alveolar stop plosive consonant. Since this is an unvoiced consonant, the vocal folds are abducted by the contraction of the posterior cricoid-arytenoid muscles for just a split second of time. The vowel I is considered to be a closing diphthong, which means that the last vowel is at a high constriction with frontal placement. We have to consider the diphthong placement there because, as you can see, she's a little bit of a southern accent on the vowel I. Just like "go," TI is a forward co-articulation. This means that the apex of her tongue will start with the tongue on the alveolar ridge, but then the influence of the I vowel will make her lips open, and her apex section of her tongue will move from her alveolar ridge to the bottom section of her oral cavity, and the dorsum section of her tongue will move to the back of her oral cavity, which will cause her velum to continue to stay up and back from the contraction of the muscles that we stated before. Her jaw will also separate due to the contraction of the muscles we also stated above. When she moves to gers, the vocalic semi-vowel palatal R will influence the G, making it to a ger. This would also be considered a forward co-articulation because the vocalic R influences the placement. The vocal folds stay adducted since all of these consonants are voiced. The tongue will move from being produced into the velar section to the palatal section when the R is voiced because of the dorsum section of the tongue moves from touching the velum to touching the hard palate, which causes the velum to continue to stay up and back from the muscles that were stated above. Since the R is a semi-vowel, the velum is closed but not tightly. Finally, when she ends with the S in tigers, it does not sound like a normal S. It sounds like a Z, which makes sense because the way that we speak is not the same way that we write a word. When she says the RS, this would be considered a backward co-articulation because the semi-vowel R influences the S, which is voiced as a Z. When she ends her utterance, her lips are still rounded due to the influence of the R and the contraction of the orbicularis oris. Her velum is still pulled up and backwards, and the tongue is placed on the hard palate to make the voice R. Overall, since her speech is connected, her velum is continued to stay up and backwards during the entire time she says her utterance because there are no nasal consonants used. As we end this presentation and looking at our citations, let's look at the video again of the cheerleaders saying "Go Tigers" and think about the respiratory, phonatory, and articulatory systems working together to have her pronounce the saying "Go Tigers."
Go Tigers!